can you talk to us a little about these? What are some of those warning signs that you may be experiencing some form of miscarriage?
So yes, the most common symptom for miscarriage is definitely bleeding, abdominal pain. You get cramping like you're having a period. In case of an ectopic, you need to be aware that if you have severe bleeding and you feel like, oh my God, I'm going to pass out, you definitely need to go to the emergency room. If you're having mucus or real contractions, like you feel like you're in labor. And then symptoms of like a period, breast tenderness, back pain, nausea, vomiting.
And some of these signs are brown or bright red bleeding, with or without cramps. You have clots passing from the tissue clots passing from the vagina.
Yeah, so I always tell my patients, if you see weird tissue that looks like chicken skin, or looks a little whitish, or looks a little purplish, that's not normal. So that probably means you already passed part of the pregnancy or the whole pregnancy.
And when it comes to a miscarriage, is there anything you can do to prevent a miscarriage, or is that sort of something that happens in the body? Yeah,
it's actually something that just happens. It's important to, at the beginning of the pregnancy, avoid doing difficult activities, or avoid doing big weights, or avoid doing, things that will make your risk higher. But I think, like I said before, I think this is the way of nature telling you, okay, your pregnancy is not normal, let's get rid of it and try again.
Is miscarriage something that happens more in the first trimester? Is it something that happens later in the pregnancy? When exactly does it happen?
Yeah, so miscarriage is more common in the first and second trimester, especially in the first trimester. I would say that the 20% of it happens in the first trimester. I always tell my patients to not tell their families they're pregnant until they pass the first trimester. After that, the probabilities go down to less than 1%. So if you don't have a miscarriage in the first trimester,
which is the first 13 weeks, correct?
Correct.
Okay.
Then most likely the pregnancy will stick.